Okay, so we are going to talk about embryology, and um, one thing that you have to always remember is that it's a very incredible process of human development. It's from cells, just a single cell, to a complex organism. So embryology actually reveals the blueprint of life, and we are going to explore the key developmental events and the fantastic processes that shape life and the common abnormalities that can occur also. All right, so as you can see in this diagram, this is an overview of the developmental events, processes, and abnormalities. Always remember that basically from fertilization in week one, it starts with just a sperm fertilizing an egg in the fallopian tube and forming a zygote, and then the zygote divides into cluster of cells and then become morula, then blastocyst, and then implants into the uterus by the end of week one. Gastrulation also continues from weeks 2 to 3. That is, it forms three germ layers: the ectoderm, mesoderm, endoderm, and the layers then lay the foundation for organs and tissues. Yeah, so there's one key structure called the notochord. We'll talk about that later. Then neurulation also, that is when the ectoderm folds to create the neural tube, the precursor to the brain and the spinal cord. And also the neural crystals also migrate to form new structures like nerves and facial bones. Okay, so organogenesis too is another thing too. So during that phase, that's like around week 4 to 8. That is also another thing. The major organs begins to form. So the heart starts beating by day 22. The limbs, eyes, ears also form by week 8. The embryo actually resembles a small human. The fetal period, as you can see over here, from the ninth week to birth, or the third month to birth, um, the embryo is now called a fetus, and this stage focuses on the growth and maturation. So by week 20, fetal movement can be felt, and by week 24, the fetus is variable outside of 24 to 28. Okay, right. So as you can see over here, um, the first week, the first 2 weeks, that's where the blastocyst is formed. First 2 months, the main embryonic period. So here the first 2 weeks is a period of cell proliferation from zygote to morula, like I said, to and the formation of the bilaminar um, embryonic discs. So birth defects do not originate in this period because the body systems and structures have not yet developed, and teratogens usually cause the loss of entire conceptus. Okay, that's for the first 2 weeks. That's where you have the blastocyst, and then the main embryonic period, the first month and the second month, weeks 3 to 8. Like I said, is a very very dynamic period. So over there, there's a folding of the embryo and the formation of the organ systems, and because it's the most active period of the development and differentiation, the embryo and in this like is most vulnerable to birth defects. When you get to the fetal stage, that is when birth defects are not usually seen. Yeah, they are not as severe um as compared to weeks 3 to 8. Yeah. All right. Okay, so the first week, as you can see in the ovary, there's a developing follicles, the mature follicle, discharged at the ampulla of the uterus. Fertilization occurs within 12 to 24 hours. The zygote is formed, gets to the two cell stage over here by 30 hours, four cell stage by 40 hours, and the early morula around 80 hours. And then, as you can see, this is the myometrium, the endometrium, and that's the blastocyst. So the advanced morula is like for 4 days, and by 5 days the blastocyst is being formed. And then early implantation actually occurs 6.5 days. And as you can see, the embryoblast, the inner cell mass, the blastocyst cavity, the cytotrophoblast and syncytiotrophoblasts that embeds into the myometrium. Right, so by the second week, as you can see, this is like 7.5 days. Okay, so over here, this is just a uterine lining, the uterine endothelium. This is the syncytiotrophoblasts. This is the endometrial stroma, as you can see over here. The syncytiotrophoblasts, the cytotrophoblast, the amniotic cavity, and the epiblast. So this is definitely the hypoblast. And then you can see the primitive yolk sac. Okay, that is for the um 7.5 days. So when you get to the 12th day, so approximately the 12th day, you will see these differentiations over there. The syncytiotrophoblasts over here. Okay, and then burden is more than that of the 7.5 days. Okay, and then the cytotrophoblast, as you can see over here. Okay, the amniotic cavity, of course, is here. The primitive yolk sac still here. That's like a differentiation from the blastocyst cavity to this. And there's a hypoblast and the epiblast. You can see the epiblast. Okay, so this new layer is the extra embryonic mesoderm. Okay, I hope you can see the red lining over here. All right. Okay, so by the 15th day, more differentiations occur, and there's the extra embryonic mesoderm. What is the exocoelomic cyst? That's what you can find over here, and that's the definitive yolk sac. You can see the yolk sac over here. Okay, the extra embryonic mesoderm a bit thinned out compared to the previous one. All right. Okay, so here the extra embryonic mesoderm is over here, but this is the extra embryonic coelom. Okay, and of course the amniotic cavity within here, and ectoderm, the endoderm. Okay. Okay, so this is a connecting stalk. Here your guess is right. The syncytiotrophoblaст and then the cytotrophoblast over here is the endometrium, and here, like I said, the extra embryonic mesoderm. Alright, so by the 17th week, the differentiation is quite clear. You can see the intra embryonic mesoderm over here, the ectoderm, the endoderm over here, the precaudal plate, the yolk sac, and then the connecting stalk over here, and the extra embryonic coelom that is outside. Okay, so with the embryonic period, just remember that by the third week, as late week 3, you have the neural plate and the neural groove, and then the somites appear by day 20. Okay, so that's the closure of the neural tube, the early closure of the neural tube by day 21, and by day 22 the late closure. You see it closing up, and that's the caudal neuropore, the cranial neuropore. That's still early week 4. Right, but there's a dorsal view and a sagittal view. You could see here the aortic pit, the lens placoid, in the pharyngeal apparatus over here. So the pharyngeal arches appear by day 26. You see the first pharyngeal arch, the second, the third. Okay. So the fourth and sixth are not so visible over here, but that's the okay, heart bulging over here. Umbilical cord, the tail bed, that is by the middle week of week 4. And here too you can see the maxillary prominence of the first pharyngeal arch. The first, okay, so that's the mandibular portion, the second pharyngeal arch, and the third and the fourth. Okay, but as it cannot be found over here, it's not so visible. And that's the arm bud. Okay, the limb buds appear by days 28 to 29. That's the leg bud. All right. So by week 7, you could see them, the first pharyngeal arch, and then the um here, this and this are the paddle shaped limbs. Okay, so the cardiac prominence is still over here, and there's the olfactory pit. There's the optic cup, developing eyes over here. Remember the name we gave, right? That's the lens placode over here. It's been differentiated into that. By early week 6, you have the external ear and the elbow, and also here the digital rays developing. And by week 7, the external ear, so visible the eyelids, the webbed digits, and the an umbilical hernia, the rotation of the GIT to okay, external ears here, separated digits, the natural of course the physiological midgut herniation too by week 8. And with the fetal period, it's from 3 months till birth, eyes are closed as week 8 to 16, the early fetal period. So intestines return to the abdomen. The sex is distinguishable. That's by week 12, and the hair appears by week 20, 26. The eyes open up. The fingernails, of course, appear. The toes, the toenails also appear too. Okay. So there is actually little body fat by week 22, and with the within the middle fetal period, that's around 16 to 30 weeks. That's where you have all these happening. But by the late fetal period, that's almost full um, differentiation happening over here. So there is firm grabs by 36 weeks, and also for the males, the testes in the scrotum or inguinal canal by week 38, and that's the late fetal period. Alright, so these are some few histological concepts that we looked um, early on. So here the uterine epithelium is actually a simple columnar epithelium, and you see the stroma, then endometrial stroma, that's loose connective tissue to you see the situ trophoblast, and then the cytotrophoblast over here. It is actually a stratified cuboidal epithelium, the amniotic cavity, the epiblast, the hypoblast. But the epiblast is a simple tall columnar epithelium and simple cuboidal epithelium for the hypoblast, and also for okay, this is a primitive exact like we said earlier on, and simple squamous epithelium at the end um of the blastocyst. Okay, you know, maternal blood vessels, as you can see over here. Right. Okay. So other this the loose and dense connective tissue. You can see the fibroblast over here, the macrophages, the lymphocytes, the monocytes over here, mast cells, and the fat cells, adipose tissues, macrophages over here, eosinophils, plasma cells, the red blood cells, endothelium. Okay, that the pericytes, the reticular fibers, 10 modified collagen fibers too, and also the collagen fibers like this, amorphous matrix, as you can see over here. Okay, these are longitudinal bundles of the collagen fibers. Okay, right. So here with the skin, you will see the various layers: the epidermis, the dermis, the subcutaneous tissues. All right, and this is the wall of the yolk sac. So here you can see the mesenchymal cells and the yolk sac endoderm. That's just a simple cuboidal epithelium. But with that of the skin, see the hair follicles over here and the various parts of it. Okay, so here the cuticle, the that is over here. We can I hope you can see it. What is the hair shaft? The hair shaft over here, and then that's the cuticle, and that's the internal sheet. Okay, and this part is the external sheet, and you see the glassy membrane over it, and the connective tissue layer too over here. The um hair cuticle, of course, from here there's you could see it clearly over here too, and the hair matrix, and that's the papilla of the hair follicle. All right, so that is for the hair, but you could see the sweat gland over here too, and then of course there's an artery, there's a vein here, the sensory nerve endings, and also the um, elastic fibers pointing over here. The sebaceous gland to it's here. That's the sebaceous gland. Okay. And what do you think this is? Because it's a muzzle. So the erector muzzle of the hair is over here too. Okay. That's the monocytes, and the free nerve endings are also over here. Okay. Okay. I hope you can see the nerve endings over here too. All right. Okay, so we'll look at the various layers too. Okay, so the epidermis, we have the um, stratum corneum, stratum lucidum, the stratum granulosum, spinosum, and basale, and you can see them. They're also clear over here, but let me use the magnifying glass. Here you can see the sweat pores over here. The Meissner corpuscle too over here. But the stratum corneum is the upper surface, and then the next one is the stratum lucidum, and then you can see the granulosum, the basale, over the spinosum before basale, which is the least the inferiormost layer of the epidermis. Alright, so that is that is for the epidermis, and the dermis you have your the dermal papilla. That's a you can see the layer over here, and the reticular layer too is over here too. And the subcutaneous tissues, that's where you have a lot of the adipose tissues over here. You can see the yellowish discoloration over here. Okay, so these ones are very clear. The subcutaneous artery and the vein too, and that's this cutaneous nerve coming over here. Okay, there's an autonomic nerve, motor nerve too. The skin ligament, retinacular cutis, that's also over here too. Okay. Alright, so let's quickly go through this. Like we talked about the neural crest cells that's over here, the neural plates forming the neural tube over here too. Okay, the yolk sac, the mesoderm, endoderm, the ectoderm, and you could see the mesoderm too. Okay, so the lateral plate mesoderms over here, intermediate, and then paraxial mesoderm too. And here, that's the eyelid primordium. You can see the mesenchymal condensation, which forms the layers of the globe, the cornea and the sclera. And then over here to the hyaloid artery, the inner layer of the optic cup, there's a visual retina, and the optic cup too over here, pigmented retina epithelium too. So with the bronchi and the lungs from week 5 to 6 weeks, we have the trachea, the right main bronchus, the left main bronchus, as an airway. The airway over here is lined by epithelium derived from the endoderm of the foregut. Right, and here too is the secondary bronchi to the lobes of the right lung. And you can see over here the secondary bronchi to the lobes of the left lung, and the splanchnic mesenchyme ventral to the esophagus. As a lung stroma, this is a visceral pleura that you can see. Okay, these ones are very clear and very simple. So upper limb and the lower limb, butts at 5 to 6 weeks. So with the cranial and spinal nerves normally by 36 days, that's when you have them there. But the formation of a joint cavity between the developing bones here, it's almost osteology. We have the pre-cartilage, condensation of the mesenchyme, and here future site of the joint cavity, the mesenchyme becomes rarefied, and here you have your cartilage, that's a rudiment of the bone, the precondium, the joint capsule, the circular cleft, there's a joint cavity, the um, precondium, and there's the cartilage over here. So, okay, so with the segmentation and early pattern formation, you have your yolk sac over here, the amnion as the cut edge over here, and then the circles between the amnion and the embryonic disc. That's still the primitive streak, and then the primitive knot or the Hansen's node. Okay, and this the segmental distribution of the dermatomes and myotomes. Okay, that's the membranous labyrinth of the inner ear. It's optic and the post-optic too. Occipital myotomes. You have 1, 2, 3, 4, and the cervical myotomes 1 to up to 8, and the thoracic myotomes 1 to 12, of course. Okay, you can see the lumbar myotomes here 1 to 5, the sacral myotomes 1 to 5, coccygeal myotomes too over here. I remember the cervical myotomes are 8, 4, and then the um that's the occipital myotomes, that's for cervical 8. Alright, so the origin of each trunk myotome also represent territory of the dermatome into which motor and sensory fibers of the segmental spinal nerve extend to. Okay. Now let's look at the segmentation and early pattern formation. You have the prosencephalon over here, the optic cap, the notochord over here too. Cranial nerve 3, 4, cranial nerve 5, okay, 5 over here, then cranial nerve 6, 7, and then you have 9, 10, and 11. You follow that pattern. See the optic vesicle, and in the whole of this part to here is the rhombomeres to okay the pharyngeal arches. You can see 1, 2, 3, 4, and those are the somites. Somatomeres are the ones over here too. This is just a lateral view, and with the cartilage derivatives of the pharyngeal arches, you see the stapes, a styloid process, stylohyaloid ligament, the greater horn of the hyoid cartilage, and also the thyroid cartilage, as a cricoid cartilage over here. Okay, incus malleus, a future sphenomandibular ligament over here too, and that's the lesser horn of the hyoid bone, upper half of the um, hyoid body, and the lower half of the hyoid body too. Alright, so with the cell adhesion and cell migration, always remember this is the ectoderm, that's the spinal cord. You could see over here the demomyotome over here, the neural arc, the vertebral body over here. Okay, that is towards the vertebral body, and that's to the costal process. The notochord is over here. That's directly beneath the spinal cord, as you can see here in the diagram. The posterior cardiac vein is also over here too, and the mesoderm too. Right here, right here. I hope you can see it. It's also very clear. The cilium too is right here too. Okay, so the sclerotum contributions are basically that's from the neural arc, the vertebral column, as you can see here, the centrum and the costal process. But migration to the neural crest cells, like from its ectodermal origin to the autonomic ganglia, you can see it's just moving from here through to the gut tube. And that's where you have your enteric flexus ganglia. The That's a parasympathetic input for smooth muscle and glands too. Yeah. So the neural crest cells over here is the neural tube, the dorsal root ganglion, and the dermatomyotome too over here. Okay. You see the sympathetic chain ganglion. It's sympathetic for the spinal nerves too. Okay. And that's of course the gut tube. And here it's exactly. Now I hope this is very very clear. The cell differentiation and cell fate, the mature follicles in discharge occurs, fertilization occurs, the 2 cell stage, 4 cell stage, the early morula, and then finally to the embryoblast, and the blastocyst, and then embryoblast. You could see over here the blastocyst cavity, the cytotrophoblast and cytotrophoblast over here. There's a myometrium, endometrium, myometrium over here. All right. So here, the olfactory placoid is over here. The cellular fate map of the embryonic disc showing the ectodermal contributions of the future nervous system. You can see the various placodes here, the optic area, the lens placode, the factory placode, the hypophysis, and that's the forebrain, the midbrain, the hindbrain, axial rudiment, the spinal cord, the neural crest cells over here too. Right, so the growth factors from week 6, the limb buds in um, week 6 embryo. The growth factors that influence the limb morphology basically are the fibroblast growth factor 8 that leads to the limb bud initiation, retinoic acid limb bud initiation. So the we have factor 2, factor 4, and factor 8 are growth of the limbs. The fibroblast growth factor 2, 3, and 8 are growth of the limbs. The bone morphogenetic proteins. There's apoptosis of cells in between the divots, and also sonic hedgehog establishment of the craniocaudal limb axis too. There's patterning of the limbs too, whether dorsal or ventral. Right, and there's a section across the limb, and you can see the extensor muscles, the flexor muscles, and here too mesenchymal bone precursor. You see the anterior division of the nerve, the posterior division of the nerve. That's the pre-axial compartment, and there's post-axial compartment, anterior division and posterior division, ventral compartment, and the dorsal compartment, which has the external, um, the extensor muscles and the posterior division nerves and anterior division nerves too over here too. Right, so um the growth factors promotes tissue development basically. Yeah. The bone morphology, um, morphogenetic protein family, it leads to definitely bone development like I talked about. We've talked about the transforming growth factor beta, and also that of the growth factors too. Fibroblast growth factor 8, insulin like growth factor 1, and the nerve growth factors too. That's both for sensory and somatic neurons too. Alright, I think this is very clear. Okay, so clinical correlations. So with the abnormalities or the anomalies that usually happen, we have three major classifications of it on the errors of morphogenesis. So here, always remember the abnormal tissue formation. That is one thing. Okay, and the next one is abnormal forces on the normal tissue, and the third category has to do with the destruction of the normal tissue. So those are the main three: abnormal tissue formation, abnormal forces acting on the normal tissues, and destruction of the normal tissue. So when it comes to the um, abnormal formation of the tissues, could be malformation or malformation sequence. This could still lead back to any of the other categories too. And with the abnormal forces acting on the normal tissue, could be deformation or deformation sequence. And with the destruction of the tissues, just disruption sequence acting on the tissues too. Alright, so with the malformations, as for the abnormal tissue formation, let's look at something here. Right. Um, could be a morphological error, developmental structure. There's a primary structural defect, failure of the neural tube to close, and that could lead to myelomeningocele. That's what you can see over here, failure of the neural tube to close. All right, as a malformation, so etiology usually chromosomal, genetic, teratogenic, and also idiopathic unknown. Okay, so for the primary structural defect forming an error in the tissue, that's for myelo meningoso. Right. So let's talk about clubfoot uh, deformation over here. Over here, the um, deformation, it falls under the second category. That's abnormal forces acting on the normal tissue. So the etiology is normally extrinsic, fetal constraint or intrinsic fetal akinesia. That's an abnormal force, and then yeah, so normally develop structure, alter structural position. You can see the intra force forcing it inwards, forming the deformation, clubfoot forming. And then there could be a disruption, uh, the etiology vascular, compressive, or tearing. There could be vascular occlusion, abnormal force, and they normally develop structure leading to um, tissue destruction. Okay. Of course, if there's vascular occlusion, ischemia, necrosis. So there's destructive forces is that there's the limb reduction deficits or disruption. If he has no limb. Okay, so other classification of this include whether syndrome or sequence. That is the patterns of multiple anomalies. So over here you could see the PAR syndrome. Okay, there's atrial defect or ventricular septal defect, very common over here, and we see the bruises and the ulnar head protruding over here. So with these star syndromes, and usually um, autosomal recessive inheritance pattern, and includes usually includes two abnormalities: thrombocytopenia, absent radius, may be associated with congenital anomalies, as you can see over here, and autosomal recessive transmission too. See the ulna protruding over here, just the humerus, no radius, and here absent or defective megakaryocytes too. The etiology usually chromosomal, genetic, teratogenic, or unknown, and it falls under all the three categories. Whether, um, yeah. So the syndrome, the primary anomaly too. So multiple, but it's actually non-sequential pathological related anomalies. Right, that's it. But the Robin sequence, like as you can see over here, there is an intrinsic cause, extrinsic cause leading to primary anomaly, the malformation, deformation, disruption. And this leads to a secondary anomaly. So that's the sequence. Um, that's sequence comparing that to the syndrome. Okay. See the hypoplastic mandible, the primary anomaly, and then that leads to glossopsis, primary anomaly. That's a secondary anomaly, and then a tongue obstructs the palate fusion. That's a secondary anomaly also, and you could see the U-shaped palate. That's also a secondary anomaly, and that could lead to area obstruction. Okay, so any of them, either through this way or that way. Okay, so that's for the Robbins sequence. Mm. Okay, so the sequence of the anomalies is initiated by hypoplastic mandible that causes the glossopsis, and then resulting in palatal defect with glossoptis, which may obstruct the airway. And you can see over here how there's hypoplasia of the mandible. Okay. Right, so let's look at more classifications of um, the malformations. You see the normal variant over here. There's a flat nasal bridge. Okay. So we look at the rest, the other minor variations, and also the major malformations. Okay, see hydrocele, that's um, syntactically of the second and third toes together. You can see the palmar crease over here. There's a simian crease or fold, and here too. Um, the clinodactyly of the fifth finger. Okay, downward slant of eyes. Right here to the major malformations that we have here: atrial defects, the ventricular septal defect. So the cardioseptal defects, the risk of occurrence is from 2 to 5%. You can see the pits over here. So here, isolated cleft lip, the risk of occurrence is 4%, but the clefts with lip pits indicates autosomal dominant um, syndrome. So that's here, you have the pits over here. There could be pyloric stenosis, and the risk of occurrence is 2 to 5%. And over here, the myelomeningocele anencephaly too here. So that's when there's a defect in the neural tube closure. So with this, you can see the isolated aplasia cutis congenita, which is also autosomal dominant too. These are basically some of the minor and major malformations. Because for Marfan syndrome, that's very very clear. Remember the pectus excavatum, and also over here, um, the cataract glasses for subluxated lenses too. The arm span may exceed the height. That is very 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 long, very very long. That's also an autosomal dominant inheritance pattern too. Okay, as you can see over here. Alright, the arachnodactyly of the feet too, and that of the hands, and there could be the Steinbeck sign. The tip of the thumb protrudes when the um, thumb is folded inside a fist. When from a fist, the thumb protrudes over here. So the thumb and index finger overlap when encircling the opposite wrist too. Okay, Apert syndrome. So with this, um, the they have phases of that look like this: downward slanted eyes, acrocephaly, hyper telorism too. You see the palmar spoon deformity, the dorsal method deformation also, the high arch palate, the dental anomalies. Okay, acrocephaly with flattened midface. There's also autosomal dominant inheritance. Okay. The Lange syndrome, that one, also another thing. Is a thick conjoined eyebrows. So let's see over here. As synophrys, and you can see the thin lip over here too. There's flexor, contracture, micromelia, focomelia too, where the hands may not even develop. And there's hirsutism too. So low hairline and general hirsutism too. Adult faces with synphils or synphries, and also long eyelashes. And so the Lange syndrome. And these are more deformations also. congenital hip dislocation. Okay, of course, this is how you try to find words. If the fetus is in a breech position too. Yeah, distortions as you could see here. Multiple fetuses in the uterus. Okay, that's a bicomate uterus too. That's when there's a uterine malformation over here. Remember varus valgus. This is a varus deformity. Okay. That's for the lymph anomalies too. See a sagittal ridge on top of the head too. So these are conditions that cause intrauterine crowding. They can lead to abnormal fetal positions and cause constraint abnormalities. Okay. So here, gravida, small uterine cavity, and multigravida, large uterine cavity. So definitely can lead to a large infant. So at 6 months, the constraint-related growth deficiency is transient, giving room so infant catches up rapidly, so they all get back to their normal heights too. Okay. Scephocephaly due to sagittal cranial synostosis. That's why you have the sagittal ridge too. Okay. That's when there's a limitation to the growth of the sagittal suture over here. When there's a limitation to the growth of the coronary sutures, what happens? You have your brachycephaly due to the coronal cranial synostosis. Okay, that's the Porter sequence. Alright, so with Marfan syndrome, as we talked about, there's spectrix excavatum, that is this depression over here in the thoracic cavity, and also, like we talked about, the arachnodactyly of the feet. We talked about all these, right? So let's go on with Apert syndrome. With Apert syndrome, um, we talked about the palmar spoon deformity already and how the high arched palate and dental anomalies too are being formed too. Alright. Okay. And then remember the limitations of the growth of the coronary or coronal sutures and that of the sagittal too. The deformities that it causes, the sagittal ridge and cranial synostosis too, and also the brachycephaly due to the coronal sutures having a limitation over there. Okay. Alright, so with the deformation sequence that is in Porter's sequence, you could see the typical photos, Porter faces, the pulmonary hyperplasia, that is with the lungs over here. See the renal genesis too, the short umbilical cord over here, the amnion nodosum too could be found over here, and see how the Barrow's deformity too is being formed too, as a limb position defect. Okay. So basically, with the events in the Porter sequence, see the primary anomalies and the secondary ones. But initially, there's amniotic fluid loss, amniotic rupture or disruption, decreased amniotic fluid production. Okay, in here to renal agenesis, as you can see over here. But normally, the oligohydramnios is the primary anomaly, and causing fetal constraint and mechanical factors also coming into play. But the secondary anomalies too, you have the you have the portaphysis, the fetal growth deficiency, pulmonary hyperplasia, normally with breech positioning, and also the virus as a limb position defect. Okay. With the drug-induced embryopathies, like thalidomide, so right now it's not being used, but you see from the 23 to 33 resement line hemangioma and also flat nasal bones. You see the camellia over here too. Okay. So many deformities associated with thalidomide. From hypoplasia to complete absence of the radius, ulnar humerus, fibula, tibia, though that one is less commonly involved, and retinoic acid too, causing more deformities. See the facial features, the ocular hyper, telorism with downslanting palpebral features, also micronactia, and also the U-shaped palate. Anterolateral displacement of the hair hole, and also you see that of the ear too. That's microtial inotia with or without stenosis of the external canal. Hydrocephalus 2 may also occur, that is in drug-induced embryopathies caused by retinoic acid. Alright, so like we've already talked about the early embryonic development and the placenta timeline. Remember week 1, you have your blastocyst, and then by week 2 there's a plantation that is complete. Amnion, chorion, and yolk sac is being formed. The placenta begins to develop. So by the first month, it's 4 weeks, actually 3 weeks, castration occurs. And by fourth week, there is a folding of the embryo. Yeah, and there's the vertebrate body too is also established. And yeah, you have the fetal week, fetal period to birth. Right. So this a structure of an adult uterus, ovaries, and uterine tubes. You see the ovaries over here, the um, ovarian ligament proper, and you see the uterus. So that's the fundus of the uterus, the body of the uterus, the cervical origin, cervix over here, the retrouterine pouch or the pouch of Douglas too over here. Uterosacral ligament is over here, the ureters, you see them protruding over here. And of course, this mesometrium of the broad ligament, the broad ligament over here. Corpus luteum. Okay, you see the vesicular appendix as hydatid of Morgagni, and you see that of the broad ligaments, still the mesothelium of the broad ligaments. That's the suspension ligament of the ovary, cortez ovarian vessels. So broad ligaments, suspension ligaments, and then, of course, still ovarian ligament over here. Over the parts of the uterine tube, you have the isthmus, the ampulla, infant development, and the femoral end. Okay. See the suspensory ligament of the ovary. The ligament of the ligament of ovarian ligament proper, and suspensory ligament over here too, containing the ovarian vessels. Okay, the femoral end. That's the abdominal ostium. So eggs being released and then goes through the fimbriae. Fertilization normally occurs in the ampulla, not the infundibulum. And also, we see the mesosalpinx of the broad ligaments too, over here too. Alright. For the frontal section, you could see the fundus, the uterine ostium, the uterine part of the ovarian, um, the uterine tube or the fallopian tube. There's a uterine part that is supposed to ampulla, infundibulum, and then the femoral end. These are views of the uterine tube, and here are the epiphoron. You see that over here. Suspensory ligaments and the ovarian ligament proper too. You see the corpus luteum, the corpus albicans, Graafian follicle, or the ovary, okay, and vesicular appendix, or the highlighted of McCartney to over here. Okay. That's rather here as a vesicular appendix, but this, like I said, the porphyron. Okay, so here you see the endometrium, the myometrium over here too. And like we said, the mesometrium of the broad ligaments. Atrial vessels are running across this. Okay. Okay, and you can see the cardinal ligament too. Okay, that is here. You can see the cardinal ligament over here. For this, there's a vaginal fornix. There's a cervical canal with palmate folds. Okay, the vagina, this the external os, the cervix, the uterus. There's the internal os, external os, internal os, the cervical canal with palmate folds, and then see the isthmus of the uterus. So cervical region, isthmus of the body, and then the fundus, and there's the uterine ostium too. Okay, so when you take this section, the ovary over follicular development, over there too, you could see the primary ova over here, the primordial follicles here too, the epithelial cord growing into the superficial epithelium, that's cuboidal cells, germinal epithelium too here. So the tunica albuginea, that is this part, consisting of parts of this, and that's all the superficial epithelium cuboidal cells that you can see over here. And with the developing follicle, you see the ovum here, the zona pellucida, corona radiata around it, and the cumulus ovorus to at the end of it. And there's a fluid filled follicular cavity, the granulosa, theca interna, and then the theca externa. So here too. Alright, so here from the primary follicle it gets to the secondary follicle, and then so here you have the primary follicle growing into coming secondary follicles over here, then becomes a mature Graafian follicle, and it ruptures, it's being released, it releases the ovum, which is picked up by the fimbriae, goes into the ampulla to fertilize. So what is left is where you have your corpus luteum, and then it gets degenerated into becoming corpus albicans. Alright, so here let's start with the primary follicle. You have it over here, epithelial cord growing within, so the cuboidal cells are growing within, and then that's so you still have your primary follicle, but it grows on to become the antral follicles or the secondary follicles, and it matures to become the Graafian follicle or the mature follicle, and then when it ruptures, it discharges the ovum. But these are luteal cells that you could see over here. That's just a blood clot and some fibrin connective tissues over here. And that's the early part of the corpus luteum. It doesn't mature corpus luteum. You have so many luteal cells too, and then it degenerates to form the corpus albicans. Right, so that's the visceral peritoneum of the mesothelium, and the blood vessels entering the ovary from the ovarian ligaments, suspension ligaments too. Okay, that's just a surface, the germinal epithelium with our cuboidal cells. So here is very like as that simple measures like in pregnancy, regulation of the follicle and endometrial development in pregnancy. We see infancy, childhood, puberty, the adult cycle, pregnancy, puerperium, and then post-menopausal. So with infancy, see breast development over here, endometrium. Okay, you can see the ovaries over here. Okay, maternal estrogen also having effects over here. Okay, so at puberty, you see the follicle stimulating hormone and estrogen are having an impact um, on the ovaries, the uterus, the entire genital tract too over here. And the various hormones are being produced by anterior pituitary and the posterior pituitary. Okay, estrogen is colored with the blue color over here, affecting even the primary follicles to even the growing and Graafian follicles. And also the yellow color over here is the progesterone too. Okay, luteinizing hormone has this, and all these hormones play a very great role in the development of the primary ova, the primordial follicle to becoming a mature follicle too. And as you can see over here, progesterone maintains the corpus luteum over here, as you can see. You can see in this diagram. Mm. But it later on degenerates to form the corpus albicans, and the human chorionic gonadotropin too. You see it at this side as a greenish discoloration, so having effects even on the placenta. Okay, see its effects on the myometrium, endometrium too. All right. Okay, we already talked about these. Discharge of womb gets into the through the fimbriae to the infundibulum. The ampulla where fertilization occurs moves to the isthmus, gets into the through the uterine ostium to um, the uterus. Is being embedded into the myometrium. Citizens to trophoblast, the cytotrophoblast, the blastocyst cavity, embryoblast over here differentiated into epiblast and then hypoblast. And you see here, you see the various stages to the 2 cell, 4 cell stage, 16 cell stage, and more. That's the early morula, and then advanced morula. Then you come to the blastocyst, and then it continues. With ectopic pregnancy, depending on the site of implantation. So if it is at the cervical region, that is okay, and it could occur at this part, the uterine parts of the fallopian tube, as interstitial and tubal ectopic pregnancy, ovarian ectopic pregnancy. See, tubal, that's on the ampulla region too. The infundibular or ostial region too. So cervical ectopic pregnancy, tubal ectopic pregnancy, interstitial, and also ovarian ectopic. We have the infundibular ectopic pregnancy, and it could occur virtually everywhere too. Okay. So this is a very nice diagram about the unruptured tubal pregnancy. You can see it going over here. Okay. You can see the chorion, the amnion, the villi to invading the tubal walls, and hemorrhage in the tubal wall too. And that's the embryo over here. That's the uterus. Intraperitoneal rupture of the uterine tube. You see the blood oozing up over here. Okay. A spontaneous tubal abortion that calcified embryo in the uterine tube too. And here the very ligaments, the ovary, but you can see how the blood is being poured into the broad ligaments of the ovary. Okay. As interstitial, it could actually occur just at the ostial region, the uterine ostium, or the uterine part of the fallopian tube or the uterine tube. So virtually everything is being grown over here. Yeah. The placenta on the body wall, the liver, the stomach, and the intestines too. That's, you have your uterus over here, so actually occurring in the abdominal cavity. There's a rectum, so the urinary bladder, the pubic symphysis over here. So these are rare cases that sometimes do occur. The ovarian pregnancy directly in the ovary. Okay, this is just a recap of what we discussed earlier about the second week, the differentiations, the puplus, hypoplus, the gastrulation into the three layers too. Okay. Or the third week, we've already talked about this ectoderm amniotic cavity over here, the notochord, so the primitive knob or node, the primitive streak over here, and that's of the extraembryonic mesoderm and endoderm, the yolk sac cavity too. The migration of the cells, the original crest cells, or the cells from the primitive streak to form the intra-embryonic mesoderm too. You could see the buccopharyngeal membrane or the oropharyngeal membrane. The appearance of the neural plates, the notochord to the paraxial mesoderm, intermediate mesoderm, the lateral plate mesoderms, meaning the somatic and the splanchnic mesoderms too. As the oropharyngeal membrane or the buccopharyngeal membrane, you see the cloacal membrane too over here. That's the primitive streak, the primitive node, and the spread of the intra-embryonic mesoderms too. Okay. So the various events relating to gastrulation has been summarized over here. You can see the um, endometrium, the ovaries are trying to with the fimbriae, the myometrium. So endomyometrium, and that is the implanted, the blastocyst being implanted over here too. Okay. So now when you take this cross section and you look at it, you could see the amnion, the extraembryonic mesoderm of the amnion, the yolk sac over here too, and that's the um, chorion in the endometrium. The uterine lining over here, and this over here. So, okay. As that's the allantois, the connecting yolk sac, the amnion sac, cardiogenic mesoderm, oropharyngeal membrane, so the cloacal membrane, the yolk sac over here, the notochord, the paraxial column or paraxial mesoderm, intermediate and lateral plate mesoderms too. Okay. This is a temporal communication between the extraembryonic xylem and the intraembryonic xylem. And that's the yolk sac, the umbilical artery containing the oxygenated blood, and the umbilical veins too, containing the oxygenated blood. So see the cytotrophoblast, the cytotrophoblast over here, the pools of maternal blood surrounding villi over here too. Okay, so week 4, the one, the layers are walled, you see the buccopharyngeal membrane or the cloacal membrane, the cardiogenic mesoderm to forming over here, the yolk sac, amnion, notochord in the gastrulation, allantois, okay, the cloacal membrane, and the foreguts, midguts, hindguts region over here, stomodium, that's the forming of the oral pharyngeal membrane, then the easily developing heart tube and the pericardial cavity, and that's of the hindguts. This is the hepatic diverticulum and the septum transversum formed over here too. The yolk sac stalk and allantois within the umbilical cord. The amnion pressed against the chorion. Okay. The amnion surrounding the umbilical cord too. The notochord, the intraembryonic mesoderm, neural plates, that's the amnion, and the extraembryonic mesoderm too over here. Neural tube, so the somites from the paraxial mesoderm, okay, and lateral plate mesoderms too. And with more differentiation is happening, you see the amniotic cavity, the neural tube above the notochord, the dermato, the dermomyotome of the somites, and then intermediate mesoderm, intraembryonic xylem surrounded by the lateral plate mesoderms, and also the embryonic gut tube, the yolk sac, still compressed into the umbilical cord. Okay, this basically almost the same. Notochord, paraxial, intermediate, lateral plate, neural plate, connecting stalk, left and right dorsal aorta. Okay, the connecting stalk over here. Ventral, formation of the ventral mesentery, and the lateral plate mesoderm. This was the dermal coating of the xylem too, and the intermediate mesoderm too. Yeah, neural crest cells are the ones over here. Neural plate forming neural tube. Somites, of course, paraxial mesoderm, intermediate lateral plate, notochord, endoderm, forming the gut tube. Yeah. somatic mesoderm, splanktonic mesoderm too. And this is amniotic, tagging around the size of the foldings of the embryo. Okay, somites sclerotome surrounds the neural tube and notochord to form the vertebral column, and you can see the spinal nerves, the dermomyotomes to here, the dorsal mesentery, ventral mesentery, the gut tube, endodermal in origin, the somatopleure as ectoderm plus the lateral plate, mesoderm end. If you see over here, so that's somatopleure and the splanchnopleury. Basically made up of the endoderm plus the lateral plate mesoderm. Okay. The nephrogenic ridges are a bit small over here. You can see the genital ridges too over here too. Because that's the aorta, umbilical cord over here, and the yolk sac. It stalks out just a plane of section, but you can see the gut tube over here too. Umbilical cord, ventral mesentery, dorsal mesentery, aorta there. Okay, so with the formation of the placenta, we've already talked about all these. We've talked about the structure, the syncytial trophoblast, cytotrophoblast, ectoderm, endoderm, the primitive yolk sac, that is with day 7, day 12. So you have your primitive yolk sac over here. You can see the yolk sac, the definitive yolk sac, the endoderm, the ectoderm, the connecting stalk, cytotrophoblast, syncytial trophoblast, the extraembryonic xylem, then exocoelomic cyst. Here we have the umbilical artery, umbilical vein, extraembryonic mesoderm, cytotrophoblast, cytotrophoblast over here, the blood vessels or the villi. Okay, the endometrium and the fetal membranes. Here you can see the decidual, paritalis, uterine cavity, decidual capsularis, just right under the uterine cavity. The smooth chorion, the fetus, of course, the connecting stalk, having the umbilical cord and decidual basalis. So decidual basalis, capsularis, and paritalis. We have your chorionic villi, villus chorion to over here, the amnion to here. Okay. The amniochorionic membrane is the one you have over here. As this is a full term fetus within the uterus with low position of placenta over here. Okay, so now let's dive into the placental structure. You see the umbilical arteries, umbilical vein, the amnion over here, the chorion too over here. Okay, botulinums over here too, connective tissue septa in between here. These are the previlli, and of course that's the cytotrophoblast, pseudalia or around here. The sensitivity of a blast is actually here. The anchoring villas too. You have so many of them. These are free villi. There's cytotrophoblasts. Shells too are here too. And these are just maternal vessels. Okay. All these. And with the placenta, there are several variations. You can see the cotyledons over here too. The connective tissue sector, the maternal aspect and the fetal aspect. And with these, this A is the villus, as you can see over here. A B is a trophoblast. It's not so clear, but let's see if I could. Okay, A being the villus and a B being trophoblast. What do you think C will be? So that's the intervillus space that you have there. And then D is the anchoring villus. E. Okay, so A villus, the trophoblast being B, and C being the intervillus space. Okay, so this is actually invading the blood vessels. That's what the villus is invading the blood vessels. Remember A, right? And look at E. Okay, so it's actually invading blood vessels. Then F is just fibrinoid degenerations that you can see over here. And then this is the decidual. That is for G. So decidual basalis, and then H has to do with the glands. Okay. So A syncytial cell mass too. That's the plus I can see the fetal parts too. So here B as fetal blood vessels. Okay. Okay, so basically that's this. You see the placental variations. We have the centuriate placenta. It has this other cotyledons or loops a bit moved here, and you have the circumvallate placenta too, and then batoidal placenta. Okay, filamentous insertion of cords to others over here. So batoidal, circumvallate, centuriate placenta. Okay. Placenta previa. This is a marginal. Here, partial placenta previa. And total or central, you can see over here. Yeah, total placenta previa. Okay, this is very clear. So the surface ectoderm of the neural tube, the amnion, buccopharyngeal membrane. The other end is a cloacal membrane. You have your neural plate, the ectoderm of the of course gastrulation. That's hair, nails, the epidermis of skin. The central and the peripheral nervous system being formed over here too. And then the gut tube, yolk sac, endoderm, and that's the yolk sac, definitive yolk sac too. The pharyngeal apparatus, These are the pharynx with the pharyngeal pouches too, and the thyroid diverticulums over here, the esophagus, trachea, lung parts. Okay, so here, gallbladder, liver, see the intestines too, and the yolk, sac stalk to cloacal membrane. Okay, that's future. Use allantoisus feature, urinary bladder and rectum. Have the stomach, the pancreas too. Yeah. Somites of the sclerotum surrounding the neural tube. We talked about it. The somites, um, demomyotome too over here too. Intermediate mesoderm, paraxial mesoderm, lateral plate mesoderms. So the lateral plate mesoderms, remember the splanchnopleuri and the somatopleury to over here. Splanchnic mesoderm and endoderm, and then the somatic um, column or the somatic parts of the lateral plate mesoderm and the endoderm to form the somatopleury, and the yolk sac, ventral mesentery, dorsal mesentery. Okay, then notochord. So you can see the mesenchymes. Okay, paraxial intermediate lateral plates. That's just the axia and appendicular skeleton by week 5, and by week 8 developing muscles. Alright, so let's quickly go through this chart too. So the primordia and the derivatives, they are fit to know the ectoderm definitely. It forms the epidermis of the skin, sweat glands, sebaceous glands too, and mammary glands, the nails, hairs, tooth, enamel, lacrimal glands, conjunctiva, and then external auditory meatus, oral and nasal epithelium, the anterior pituitary, inner ear, the lens of the eye. So you have this stomodium and nasal placodes, otic placodes, and lens placodes, all parts of these. Okay, and then the neural tube forms the nervous system, the uh, somato neurons, the brachiomotor neurons, and also the presynaptic autonomic neurons, retina, optic nerves, and the posterior pituitary glands. As for the neural tube, the neural crystals forming the peripheral sensory neurons, postsynaptic autonomic neurons, all the ganglia, and also the adrenal medulla cells, the melanocytes, bone, muscles, and connective tissue in the head and neck. The amnion tube as protective back of, with chorion around the fetus. With the endodermal, so that's basically the ectodermal derivatives. But the endodermal derivatives, we have the gut tube. Endoderm, of course, forms the GIT tract, the enterocytes, mucosal cells of the GIT, parenchyma of the GIT, organs, liver, pancreas, airway, with the larynx, trachea, bronchial tree, all endodermal in origin, thyroid gland, the tonsils, of the cloacal parts of the hindgut, the rectum, anal canal, the bladder, urethra, related glands, the vestibule, and the lower vagina, and then with the pharyngeal pouches, that's part of the foregut, the auditory tube, middle ear, palatine, tonsils, crypts, the thymus, parathyroid glands, and the C cells of the thyroid gland, and the yolk sac too. We have the embryonic blood cell production mesoderm present to the umbilical cord and then disappears. The allantois from the yolk sac, and then the cloaca. Basically the embryonic blood cell production, mesoderm, vesicle, fibrous uricus, the umbilical cord part which disappears also. And then with the mesodermal derivatives, we're talking about the primordial notochord, the paraxial mesoderms, intermediate mesoderms, lateral plate mesoderms, and the cardiogenic mesoderm. So here with the notochord, of course, the nucleus pulposus of the intervertebral disc induces neurulation. And also the paraxial columns, we have the skeletal muscles, the bones, the connective tissues. So as there we have the dorsal dermis and the meninges too. Intermediate mesoderm, we have the gonads, the kidneys, ureters, uterus, uterine tubes, the upper vagina, the ductus, ductus deferens, epididymis, related tubes too, and also seminal vesicles and ejaculatory ducts. And the lateral plates, mesoderm forms the dermis. As the ventral parts, the superficial fascia and related tissues, and the bones and connective tissues of the limbs, the pleura and the peritoneum and GIT tract, connective tissue stroma, and the cardiogenic mesoderm. We have the heart and the pericardium also. Right, so that's it for the early development. We'll continue with the nervous system.